the training very intense and very demanding. But I mean, quite often you may have to encourage yourself with this scripture in Hebrews 12:2, that looking unto Jesus, the author and finisher of your faith, right? So the joy that is set for you, this promise of a soft like, you know that when you enjoy it, at the end of the day, you're going to really reap the benefits of it. So getting into the program, a lot has already been said about preparing for the primary. So I'll skip that so that you can catch up on it in the recordings. But I'll just add that radiology is one of the specialties with relatively few specialists. So the Ghana College is trying to boost those numbers, and they will allow you to start residency right after house job. And so far as like you have a facility that is sponsoring you, or you are ready to sponsor yourself, right? But in spite of the fact that they need more people in the program, radiology is inarguably the most competitive program to get in. The primary pass rate is always the lowest, and there are many people who have had to write more than once or twice before passing and getting into residency. So if you are interested in it, you need to speak to a lot of people and work really hard to get through this stage. Now, the problem with the low numbers also mean that there are a lot of locum spots for you to make money. So some people start doing locums whilst in residency. And in general, the reason why they say radiologists, people get into radiology for money is also because the locum rates are relatively higher than most or maybe all the other specialties, right? And if you're also somebody who is entrepreneurial, then radiology is also an area which can provide you with many opportunities, because there's this gap between the personnel strength and our imaging needs as a country and even as a continent as a whole, right? So if you're entrepreneurial, definitely radiology is one of the specialties you could consider. So as said, the program is offered by the Ghana and the West African colleges. So for Ghana College is 6 years, 4 years for membership, 2 years for fellowship, then 3 years for WACS membership, and then 2 years for fellowship. But the other nice thing about radiology is that if you are somebody who's also thinking of jackpying, right, then radiology is also one of the programs that can allow you to get your UK Royal College membership whilst you're still doing your residency in Ghana. So by the time you're done with residency in Ghana, you can plan so that you also have your Royal College membership as well. So because once you're doing radiology residency in Ghana, you can register, sit for the exam and all that. So as said yesterday by Dr. Nanama, a lot of people combine the Ghana College and the West African programs. They do it concurrently, and it makes sense because like you're getting two for the price of one, right? So, and if you can also afford, you can plan well, do your Royal College as well, as I've mentioned. So the Ghana College program is currently offered in Korle Bu, Komfo and 37 Military Hospital. But for West Africa, you can only do it in Komfo and Korle Bu. So if you want to do WACS alongside the Ghana College, you need to select these two facilities during your application. And then at the interview, you also need to make them aware that you're planning on doing the West Africa program so that they don't post you to 37. But sometimes you don't always get what you choose. Okay, so aside radiology being comparatively longer, there's also the issue of the exams that we write. So if you're doing the Ghana College, there are 3 major exams, right? There's the Part 1A, Part 1B, and then Part 2. So you write the Part 1A in the first year of residency, and it covers anatomy, physics, and radiographic technique. Then 1B is written in the second year, and then the Part 2 is written in the final year. So if you're doing only Ghana College, that means that in your third year, you have some kind of leeway. You have a bit of time. You're not preparing for any exam. But then if you're doing the West Africa alongside it, then you'll be doing your West Africa exam in your year 3. So literally, if you're doing the two concurrently, you'll be writing exams every year, and they are not quizzes or tests. They are real exams that you take 3 days to finish. It involves objectives, written, OSCEs, and all that. And it can make the whole thing very, very stressful. Okay. Let me skip this. So the other thing too is that you need to pass each of the exam before you can move on to the next one. So if you don't pass, you resit in 6 months. And that means that if you're doing you have to you'll be graduating 6 months later than your colleagues if you fail an exam. I don't know if you get me. If you fail twice, you'll be graduating a year after your colleagues. So yeah, these are some of the things that makes the residency program very demanding. Now, the everyday life in residency, it varies depending on where you're doing your program. Kolebu is said to be the most demanding or the most hectic one. So since I'm here, I'll touch a bit on it. And yeah, I'll use Kolebu as the case study. So like I said, you'll be writing an exam every year, but in each of the year, every month you're doing a different rotation. So you either be rotating in ultrasound for a month, and the next month you go to CT, plain films, MRI, and so on and so forth, right? And we have morning meetings from 7:30 to 9 a.m. Sometimes it can extend to, let's say, 9:30. So every morning you're coming to work around 7:30, right? And this is from like Monday to Friday. Sometimes on Tuesdays may be free. Previously, Tuesdays were free, but now that other meetings scheduled there. So it's occasionally that you have that for free. So if you're doing a rotation like CT scan, that means if you come to work at 7:30, you'll be closing around, let's say, 9 o'clock in the evening. So those are the heavy rotations, but the timetable is arranged in such a way that you do one heavy rotation, the next month you're doing a lighter one, let's say plain films. And for plain films, if you come to work at 7:30, you do the morning meetings and you start work, let's say by 2 o'clock you close. So that is how it works. The other thing too is that like the morning meetings that we are talking about, residents are given topics to do presentations. So in a year, you may do one or two presentations, and after the presentation, the specialist projects images that you're supposed to discuss and comment on. So you're constantly on edge because you need to be ready to answer the questions, and your lecturers, your specialists are also judging how well you're studying. So unlike the other specialties where you have to, you can relax a bit, and when it's getting to your final exam in your final year, you become very serious. Radiology is like every day you have to be on point, and that is very stressful for a lot of people. So when it comes to our leaves, that's a nice part of radiology because we don't always go for the strict 18 days. So if you are on leave, you are on leave for the whole month, and you have 2 leaves in the year. So 1 month in the first quarter, and then the other month in the second quarter. But that's for Kolebu and Confanoche, I think. But for 37, they have 6 weeks, and you take 2 weeks at different times in the year. So our leaves are, I think, better than other residencies. For 37, they say that their training is a bit more lenient as compared to Confanoche and Kolebu, because they usually by 2 o'clock every day they've closed, so they have a lot of time on their hands to study. So you hardly have people failing coming from 37. But the other thing is that if you go to 37, that means that you can't do the West Africa programs alongside. Again, 37 doesn't have all the equipment, so they have to do some of the rotations in other facilities as well. Okay, and then observership. So even though the program is long, like it's 4 years, other programs are typically, for the membership is 4 years. Other programs are typically 3 years. You can go for observerships for even up to 6 months. So let's say you're in your third year, you want to, you're not worried or any year at all, you're not worried about your exams or anything. You can apply for an observership, and then you'll be given permission to go for it. In Kolebu has a partnership with UPenn, and when you go for the observership there, the hospital doesn't charge you anything. So it's free for that whole period. If you just have to take care of your accommodation and your flights, your travel expenses and all that. And in terms of fellowship, there are so many fellowship options from breast fellowships to general radiology to interventional, and even now there are fellowships in AI and radiological tech and all that. So there's a wide range of specialties that are available for you. So again, if you're the type that easily gets bored with, doing the same thing over and over, like some of the specialties that you'll be hearing about today, then radiology is definitely the one for you. So in conclusion, radiology as a specialty is very fulfilling and rewarding in all ways, right? But the residency is a very hard ride. Anyway, but most good things they say hardly come easy. So it's definitely a specialty you should consider. And when you apply and you come and look for me. Thank you very much.
Thank you to Dr. Bonsu for that amazing presentation with that illustrative PowerPoint as well. Thank you. Thank you so much. We would move on to our next speaker. And like I shared earlier, if you have any questions, kindly drop them in the chat section. Our next speaker is a resident from the dental surgery specialty. Kindly help me welcome Dr. Dent Rosemary Apple. Dr. Apple, if you are here, you can take over now.
Hello, everyone. Can you kindly hear me?
Loud and clear.
Right. All right. So I'm Dr. Dent Rosemary Apple, and I'll take you through the various specialties, subspecialties we have in dental surgery. Currently, 8 subspecialties are the ones running in Ghana. And so I'll go through them quickly, and then we'll go through how to get into these specialties and some coping mechanisms. So for the first is restorative dentistry. So it's a straight fellowship programs. All of them are straight fellowship programs. And then you need to have a passion for endodontics, prosthodontics, that's fixed and removable, and then restorations is currently being undertaken at Kolebu Teaching Hospital and then Konfanoche Teaching Hospital. But you need to make up your mind to get some dental tech tools that can make your life pretty easy in this field, such as apex locators, rotary endosets, and loops. It makes the work so much easier in this field. And so you can put some or set some money aside to get these things as well. The next is periodontology, also a straight fellowship program. It deals with gingival health and surgeries. The dental surgeons on the call will understand gingivitis, periodontitis, dental implantology, bone regeneration, as well as things related to periodontia. So if you feel you are more inclined to these things and you would want to do these things for the rest of your life as a dental surgeon, it would be good to pursue periodontology. Currently at the Greater Accra Regional Hospital, Ridge, and then Kolebu Teaching Hospital. Then we have oral pathology, also running the same straight fellowship program. And then it involves the study and diagnosis of diseases affecting the oral cavity, i.e. oral cancers, mucosal lesions, salivary gland disorders. You need certain diagnostic techniques that would be good if you had picked it up from working a year or two in the district. Biopsies, histopathology. Currently, Kolebu Teaching Hospital is the only facility running the program. Oral pathology is sometimes confused with oral medicine. So I hope this explanation will give a clear understanding of both fields. For oral medicine, Also, straight fellowship will deals with medically complex dental patients. So you are dealing with issues like oral mucosal diseases, salivary gland diseases, infectious diseases of the head and neck neuropathic pain, and orofacial pain syndromes, i.e. trigeminal neuralgia. Currently, we have only one consultant and two specialists in the field, very deprived. I think of all the specialties, it will be oral medicine. So I will encourage some that have interest in internal medicine, especially to take up this course. Then community dentistry, dental public health, that's my field. Also running a straight fellowship program. Our focus is on promoting oral health and preventing oral diseases at the community or population level. So you will be in charge of developing policies, helping increase access to oral health facilities, bringing oral health facilities and care to the people in the community, and then research focus, evidence-based practices, going into the field, finding out what works best for them, and adding certain reforms to the dental procedures that will help the population in general. Currently, it's only Korle-Bu Teaching Hospital that is undertaking that. Then oral and maxillofacial surgery. That is more popular because they have relations with surgery, ENT, ophthalmology, so it's more popular. And then also straight fellowship. They carry out surgical extractions of impacted or problematic wisdom teeth, dental implants, corrective surgeries for misaligned or deformed jaws. You have surgical repair of facial surgeries, removal of cysts, tumors, other lesions in the oral maxillofacial region. And then carried out currently Korle-Bu Teaching Hospital, Komfo Anokye, Greater Accra Regional Hospital, and the 37 Military Hospital. So if you don't want to come to Korle-Bu or Komfo Anokye, there are other options for you. Then orthodontics, the money-making field. So it's also deals with the diagnosis and treatment of dental and facial irregularities. You usually see a lot of people moving around wearing braces or aligners. That's the special subspecialty that deals with that. And so if you are more interested in that specialty, you need to prepare for certain things. You need to be financially stable because you'll be getting certain materials that would require you to run this program, and they are quite costly. You would have to buy cameras, and the cameras are not the easy cameras for like it's high-tech cameras that will help you take high precision pictures, because you need to compare before and after photographs to know if your treatment procedures are moving like you want it. And so you would have to prepare to get these items. They are quite costly. So kindly set some money aside if you want to pursue orthodontics. For pedodontics, pediatric dentistry, it deals with the oral health and dental care of infants, children, and adolescents. So we set them up for a lifetime of healthy smiles. They deal with preventive care, restorative care, interceptive orthodontics. You have some form of orthodontics in pediatric dentistry as well. And then trauma management. Currently, it's only Korle-Bu Teaching Hospital. For primaries and interviews, like my first speaker, is both Ghana College and then West Africa College of Surgeons. The exam is really, really, really difficult. So you would have to study hard for the program, a lot of your basic sciences. For the West African College of Surgeons, the primaries are based on the update course that they carry out. Unfortunately, for my time, there was no update course in that year for dental surgery because the numbers were not much. But then you can rely on the update course that was carried out a year before, 2 years before. Usually it's same, and then you can get from your predecessors and then go through and prepare adequately for the exam. It's very difficult, so you need to prepare adequately for both exams. After passing the exams, interviews are conducted by various faculties. So if it's orthodontics, periodontology, community dentistry, whichever one, you'll be interviewed by seasoned consultants in that field. And the interview is not easy peasy because they ask you theoretical questions. They'll ask you some application questions based on your experience so far. And then you would have to tell them the reason why you want to pursue that particular course. And mind you, not everybody is absorbed, so you need to impress them. We have very few specialists in dental surgery, and so we'll encourage a lot of people to apply. Since it's a deficient area, I think at a house job, you can apply to enter into any specialty in dental surgery. Some coping mechanisms. You need to be very prayerful. But if you're a Christian, be prayerful. A Muslim, ardent, pray, like pray, 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 pray. And then for time management, you need to manage your time effectively. For dental surgery, you carry out some form of procedure on every patient that you consult. And so you need to be timely about how you go about things. Otherwise, from morning to evening, let's say you have 5 or 6 or 10 patients to see, and you're performing a surgery on each patient, you would have to manage your time wisely to be able to finish and rest in between. I'll talk about, okay, so the next one is self-care. For self-care, the way we sit poses a lot of ergonomic issues. So you need to massaging your wrist. You need to at least go for massages for your lower back and then your neck. Exercise a lot because the posture we assume during working is makes gives us some comorbidities that has to do with our nerves. Can you hear me? Since my line is breaking. Can you hear me, please?
Yes, you can.
Yes, please.
All right, thank you. So that's for self-care. And then support network. Get as much support that you need from your colleagues, from friends, from your immediate family. If you're a family person, married with kids, kindly get a lot of help before starting the residency program. You cannot use your children as excuse when you are mandated to carry out a particular task. It comes off as not being serious. So try and make arrangements so that your children are properly catered for, your spouse properly catered for, and then your residency program properly catered for. This is 100 million advice. You need to balance your life very, very well. Otherwise, you get frustrated in the program and feel the whole world is coming to an end. So I think you need to give equal attention to family, equal attention to your spouse, and equal attention to your program. And then for financial literacy, this is for every field. You need to make some time to learn about finances because as you move along, maybe if you want to set up as a private practitioner, you would have to learn how to set money aside and then invest. There's the miracle or the interesting thing about compound interest is what for me personally, as I carry out my mobile dental clinics, I have a mobile dental clinic that runs, that gives you some side income. It is very important to get other streams of income, multiple streams of income. So also read some little bits and pieces about financial literacy to help you in this journey. Boundaries setting between work and personal life, I've talked about that, and then seeking help when needed. Thank you very much.
Thank you to Dr. Apple for that practical coping mechanisms. I'm confident we've learned a thing or two from what you've just shared with us. Next, we would move on to laboratory medicine. And our resource person is a resident from Kolebu Teaching Hospital in the person of Dr. Ebenezer Tete. Dr. Ebenezer Tete, if you are here with us, we would have you now.
Hello, can you hear me?
Crystal, say.
Okay, sure. So My name is Ebenezer Tete. I'm going to be walking you through laboratory medicine. I'm currently a resident at Kolebu Teaching Hospital. So this is just a short outline of my presentation. Please, are you able to see my screen?
Yes, sir.
Okay. I'm coming. Just give me a minute. A second, I'm coming. Please, can you see my screen? Hello.
Yes, please, we can see.
Please, we can see your screen.
Yeah, we can see your screen.
Okay, sure. So, what is laboratory medicine? I think most people don't know what laboratory medicine is because we don't usually get a lot of interaction with it in school. So I chose a definition from one of our clinical chemistry books. That is the one you see at the top to be a bit more formal about what the definition of laboratory medicine is. But in essence, laboratory medicine just involves understanding what's going wrong in the body. So all the way from preclinical stage of disease, that is screening that we all do when we go for outreaches, which is actually an area in laboratory medicine called point of care testing, which is an area that the world is actually moving to right now. All to now diagnosing disease, monitoring, prognosticating. All of this is done using the lab. Not the lab in essence, as in the facility or the building of the lab, but when I talk about the lab, I mean the structure of laboratory technology. So currently, I think we are also one of the most understaffed specialties in Ghana, especially for an area like chemical pathology. We have only 2 chemical pathologists in Ghana. I think even robotic surgery, that we don't normally do a lot of, has more specialists in robotic surgery, but we have labs all around, and yet we have only 2 doctors who are actually qualified to do like proper lab work in clinical chemistry. So at least this presents an opportunity for you who is coming up, because the private labs especially looking for people who can do work in their areas. Globally, we know that medical laboratories are big business. When you look at the big 3 areas of spending outside of public health spending, we have pharmaceutical industry, we have the health insurance industry, and then we have the lab. So, and even the funny thing is, radiology talks about living soft life, but the laboratories bring in way more money than radiology could see in maybe 3 or 5 years, because everybody do an FBC, but not everybody do a plain radiograph, or not everybody will do a CT scan, even though it may be pricey. So if you are thinking of having a soft life as well, laboratory medicine just could be for you. Because even residency is not as stressful as the others, but I think we'll get into that later on. Another thing is, nowadays the laboratories are looking for selling points where if they have a doctor who is a clinical pathologist, they can use him as a point to attract doctors to bring in more patients. Because if you know that you are sending your sample to SynLab or let's say Lancet, and they have clinical pathologists who are making sure that the results that are coming to you, the clinician, makes sense, you are more likely to send it there because you know that a part of your work is already being done for you. And so there's also a lot of opportunities to branch into other areas like public health, because we saw, like, let's say, areas of antimicrobial resistance. It's all chemical, it's all microbiology, which is a part of laboratory medicine. Statistics, chemical pathology is actually what defines most of the statistics in medicine, because how do you know what a normal reference range is for, let's say, a BU creatinine or an FBC if you don't have the statistics to back it up? Entrepreneurship, like laboratory entrepreneurship, which is something in your training you'll be talked to about. Research, which is a bit more easier when you're in laboratory medicine. Medical device manufacturing and the pharmaceutical industry, they're always looking for people in our field to be able to help them develop new devices and then develop new drugs. And then forensics and law, especially for pathology, where you have to be able to go to court and then in these medical legal cases, explain what is happening in the patient, even sometimes as an expert witness to a judge, to be able to bring some clarity or some sanity to the whole process of patients taking doctors to court. And then artificial intelligence, because laboratories are tech-driven, artificial intelligence is one of the areas that has really latched on to laboratory medicine, because right now everything is moving from the realm of traditional laboratories, as in buildings, to point of care testing, where we want to move everything from the lab building to the patient's bedside. And so artificial intelligence is helping us do that. So laboratory medicine practice requires non-traditional thinking. Everybody's thinking about a locum, go and chase this locum over there, go and chase this locum over there. And let's go and cut, let's go and cut. But laboratory medicine brings you into an area where you can actually be in the lab, all right, but you understand everything that's going on with the patient, understand what the process is to be able to diagnose whatever is happening in the patient. And then because laboratories are now selling points, you can actually be working with private labs and then be able to have some money on those sites as well. And the thing is, I know there's this issue about laboratory medicine where they say the labs are fighting doctors. And so if you go into laboratory medicine, there's going to be issues. But from the way I look at it, if the private labs are poaching the doctors who are in laboratory medicine to work for them, because evidence-based medicine is now the thing, it's just a matter of time before the health industry on the government side is also forcing doctors or forcing the labs and the government hospitals to be able to bring in medical doctors to be able to make sure that the labs that come from the hospitals and the government side are also making sense. So everything in medicine starts with pathology. I guess we already know that. So it involves four main specialties: medical microbiology, hematology, anatomic pathology, and then chemical pathology. Currently, all programs for the Ghana College of Physicians and Surgeons are straight fellowships, and you can enter immediately after house job because we're understaffed. When you get in, your focus area is going to be one of these four areas. And during your training, issues of quality assurance, statistics, cutting and entrepreneurship, and then research will also feature. So the registration process is basically like the other specialties. And this is just a raw summary of the format in which questions appeared last year. Immunology, hematology, the main four get the bunch of the questions. So the interview is mainly alongside what the others have talked about. They want to know who you are, your interest, and then most importantly, they want to know whether you know that it's a straight fellowship, because that's important to them. They want you to know that you will not be getting out of the program within 5 years, within 3 years, but 5 years. And they also want to know whether you know the difference between what a fellow is and what a member is, and what a fellowship actually is. So the facilities for training are mainly Kolebu Teaching Hospital, and CATH has partial accreditation for anatomic pathology. But if you are going to go to CATH, you will still have to do your first year in Kolebu anyway, because Kolebu has all the big four medical specialties in there before you end up going to CATH to have the rest of your anatomic pathology residency. So for the first year for the Ghana College, it's basically the exposure year. You do 3 months in each specialty of the big four. Then after that, you take an exam. Then you do the next 2 years in your membership area. Then the last 2 years are to do your fellowship and research work. For the West Africa College program, is a straight membership where you write an exam just after 2 years, and then you write your membership exam after 2 years, and then that is it. So the workload and lifestyle and challenges, it depends on which your focus area is. Generally, lab medicine is not as stressful, and only hematology sees patients. So because they see patients, they tend to do a lot more patient-centered work. But the other specialties, like especially chemical pathology and microbiology, since we don't see patients directly, there's more time for teaching. Even though it's adult learning, there's more didactic lectures and then assignments, so that because it's an area that we know you don't know, so we sort of bring you along so that you can catch up and know what we know. And then most trainers are easy, relatable, and friendly. Because of the issues that we have with the labs currently, we do our chemical pathology rotations at Lancet. That's MDS Lancet, which is arguably one of the best and biggest labs in Ghana. And over there, you get to meet the CEO, and he would actually be very interested in taking you into the world of laboratory entrepreneurship. So I think this is even a selling point for laboratory medicine if you are eager to do laboratory entrepreneurship, because it's big money. So for the clinics, we have, because despite the fact that it's lab work entirely, we do some clinics and then some patient work as well. So I just listed some of them here. I think Chempath, hematology, and the micro B. And in all the specialties, you do have to do journal clubs. So in conclusion, I'll just say that laboratory medicine is flexible, it's less intensive, so you can have some balance, work-life balance in there, especially for those who want to have families and then do other things aside mainstream medicine. And your work is going to be meaningful. You are going to be helping patients even before diseases develop. up to after they have passed on, you still get the chance to still see them, quote unquote, see them and make your diagnosis. So please come on board to laboratory medicine. Thank you. I'll take your questions at the end of at the time for the questions and answers. Thank you.
Thank you to Dr. Tete for for telling us all there is to laboratory medicine. I'm sure you've stirred up the interest of others who are yet undecided. We've often heard that there is money in the pelvis. We'll probably ascertain the truth to that now. So up next, we'll call up the resident for ONG in the person of Dr. Med Makafui Kwashi. Dr. Kwashi, if you are here with us, you can come up now.
Okay, hello. Good evening to you all, and thank you so much for this opportunity to talk about the residency training in Obs and Gynae. And Dr. Nkrumah, I love your introduction by saying that there is always money in the pelvis. The previous speakers, everybody wants to have a soft life, but we all know that from medical school all the way to house job, ONG is not easy because you see patients day to day, but we still love it anyway. So the training in Obs and Gynae is actually a very extensive one, regardless of where you are training. First, we talk about how do you start training in the field. The registration for the residency program, you need to at least work for 1 year, unlike some selected specialties where you can start right after your house job. ONG is not part of those ones, so you have to work at least for a year as a medical officer, and then you should have passed your primaries in the West African College of Surgeons and then the Ghana College. You can use the West Africa College to register for the Ghana College as well. And then after passing the primaries, there is an interview session where you are asked. Right now, it's very structured. Initially, the interview used to be an open interview, but now it's very structured, and you have one obstetrics question and then one gynae question, and then you are scored, and then based on your score, you are either given admission or not. Concerning the primaries, the pass rates for the West African College of Surgeons primaries for ONG, the pass rates are relatively lower compared with the Ghana College. You can gain admission into the Ghana College. Now, some people decide to start with Ghana College and West Africa alone. College does not. Several reasons for that. One being the fact that the residency training is sponsored by the state. So in effect, you cannot be having free training and then you are not enrolling in the college training from the Ghana College. So that is one of the reasons, for that reason. Then moving on from registration, what are the available facilities for training? Now we have 10 for training in OG. We have Lebu Teaching Hospital, Konfanoche Teaching Hospital, the Greater Accra Regional Hospital, Ho Teaching Hospital, 37 Military Hospital. Now some new centers, Holy Family Hospital in Techiman. Then we have the Eastern Regional Hospital, Fienkwanta Hospital, Mali Teaching Hospital, and then Cape Coast Teaching Hospital. Now one will ask, where should I go and train? That several considerations and enough reconnaissance to help you decide where you want to train, because the truth is the training facilities are not the same. Obviously, the old or traditional training sites in Kolebu Teaching Hospital and Okonfanote Teaching Hospital are far advanced in training. However, there are certain things you should know about these training sites too. So I'm in Kolebu, and the reasons why you should choose the two top or let me say oldest training facilities is that they have been training residents for a very long time. So obviously the training capacity will be different from the new training sites in, let's say, I don't want to mention any specific ones. But the advantage of these new sites too is that you have a lot more of hands-on skills or opportunity for, ONG is a surgical discipline. So you have relatively more hands-on in some training facilities compared with the traditional ones, because the traditional ones, there's high volume of residents. For the membership program, first year alone, you could have as much as 20 people in training. So you have to compete. But the advantage of the old training stations is that they have sub-specialized. So you are able to learn from the different sub-specialties, which are not even in some of the new regional hospitals or the new training sites. So you have to really know what you want, and then the kind of background you have as a doctor. So if you are somebody that you've been in the district for a long time, you've had quite an exposure with some of the surgical skills, it would be really, really maybe beneficial if you rather come and train like maybe Kolebu or Konfanoche or 7, where you can beef up your knowledge base in the field as well. So that's what I would say concerning the training institutions. And then you select the training institutions. Sometimes in the interview, you may be given your first choice, or if you have any special reason why you have to be at a facility, then that means you have to talk to the faculty chair concerning the appointment or posting is based on performance as far as I'm concerned, as far as ONG is concerned, yeah. Then the other thing too is the structure of the training. So structure of the training is based on the additional subspecialties like anesthesia, NICU, urology, all these are fixed for every training center. But the order in which you actually enroll differs from center to center. So for Kolebu, there is always a saying that the ONG training is 1 year, because the first year is where you are going to stay in the department and you are going to, excuse me to say, slave through the training, because it's very, very stressful, as opposed to other centers where they interlace it with the rotations right from the external rotations right from the word go. So you don't have persistent 1 year of training in the department. So it varies from place to place. So for Kolebu like this, after your completion of the first year, second year, you start your external rotations, and then part of the third year to external rotation. Once you come back to the department, you have barely 4 months to sit the exam. That's why the saying in Kolebu is that the ONG training is literally 1 year, and the rest of the years you are roaming. But other facilities have a different schedule, so you have to find that out as well. And then for a fellowship training, I will not spend a lot on that because that's after the membership training. So what are the expectations during the membership training? As I said, I'll give the experience in Kolebu and a few other centers because I am at Kolebu Teaching Hospital. The first year is really stressful. It's the most stressful year for training for those who are in Kolebu. You literally don't have any life. I'm sorry to say that. It was so nice to hear those speaking for radiology and lab medicine talking about work-life balance. First year in Kolebu, you most likely are not going to have a very good balance with your life. It's going to be difficult because mostly you are engrossed in the day-to-day activities, emergency duties, night duties. These are what most colleagues want to get rid of, so they may choose to do something else. And it's quite understandable. But for Kolebu, the first year is mainly this. You hardly have enough time to study because it's mostly work. You get to the house late, tired, and especially if the number in the first year is not high enough, you are going to be in trouble, as is experienced by those who are in the first year currently. The usual numbers are 20 plus, but they are just 12, 13. And it has been a challenging year. But then from the second year, you start to do the rotations. You have an ample time on your hands. You can study. People use it to do locum. People do other things, but it's very tricky because that's the time you actually have to start preparing for your examination. Because once you come back to the department in the third year, nobody's going to think that you are exam candidate. They expect you to work, so you have to be ready once you are returning from your external rotation. So you have to be very careful with when you are doing the ONG's rotation training in Kolebu Teaching Hospital. Other hospitals are not quite so. They are very Cape Coast is very flexible. Depending on availability, you can do 6 months in the department, go for 2 or 3 months of rotation in other subspecialties and come back. So it's quite dynamic, but Kolebu is usually structured and fixed. So is Kofanoche and then a few other training sites. So the advantage of the Kolebu training, or I'm a little biased with that because obviously that's who I am, but Kofanoche too. The advantage is that you get to see every aspect of Obs and Gynae training. And quite frequently, I mean, it's study groups with some colleagues training from other places. You mention certain things and they have no clue because they are not exposed to that. It's true, no fault of theirs, but they are not just exposed to that. For Kolebu, you can be given an internal rotation in ONG, let's say maternal fetal medicine, where you learn extensively in scans, high risk pregnancy management. So Kolebu is very subspecialized. So you get a lot of exposure in diverse fields. And then the new training sites or the so not old training sites, they may give you a lot more of the hands-on experience. Kolebu gives you hands-on, but then not as much as those training sites. Then the other thing we have to talk about is the workload. I've already spoken a lot about that. It may vary from place to place, and ONG is not. I'm sorry, I'm not going to tell you that you have a very good work-life balance. You have to create it for yourself. You have to force so that you are not burnt out. But then the saying that there is money in the pelvis is still it still holds, but now you have to dig. You have to dig because there are a lot of specialists around, but the demand for Obs and Gynae services are always there. But you need to create a niche for yourself. You need to really try to, I mean, you can collaborate with other colleagues and team up and then set up your own place, and which most people are doing even before finishing the program. So, I mean, in terms of the monetary incentive, it is not bad at all. But then you have to, I mean, try and dig in a little more. And in terms of the challenges with your lifestyle, your family life, it depends on the training center. Kolebu first year may be very challenging for you, but the second and third year are quite okay. And I mean, some people even have been forcing to strip people of leave because they think that the second and third years are so relaxed. But I don't think it's quite so, because you have to prepare for exams in the third year, and second year too, you really need to pay attention to the other subspecialties. So all in all, I must say that training in ONG is quite intense, and that is the truth. It's quite intense, but when you strategize, when you plan, and when you are motivated, I don't think it's anything that is beyond your capabilities. ONG is fulfilling. You don't want to go and you are taking care of people, and then you release 19 differentials and they still die. You want to be able to, I mean, bring a smile to people's face and go home happy, even though you are tired. So, in a nutshell, I would say that it is a wonderful and fulfilling field, despite the relatively high stress compared to other subspecialties. But you should pursue a career in ONG. Thank you.
Thank you to Dr. Pashi. We'll move straight away to general surgery, and to do us the honors is our residents in the person of Dr. Med Gabriel Offe. Dr. Gabriel Offe, if you are here with us, we can have you now.
All right, thank you very much, Medtronics. I hope I can be heard clearly.
Yes, please, you can be heard.
All right, so my name is Dr. Gabriel Offe. I'm a surgical resident at Confanoche Teaching Hospital. So I'm just going to give you an outlook on the surgical residency from the resident's perspective. I rightly heard that I was introduced as the general surgery, but currently the colleges are moving away from this nomenclature, the term general surgery, because general surgery in itself is a fellowship program. So what we do in the first 3 years is the surgery membership, or better still, surgery in general. So when you come out for the first 3-year membership program, you come out as a surgeon in general. So that's the right technical way to use. So where we learn a bit of general surgery, plastics, and burns and reconstructive surgery. We also learn a bit of neurosurgery, urology, pediatric surgery, cardiothoracic and vascular surgery. Then we also do orthopaedics and then anesthesia. I'm sure you are already beginning to see how lucrative surgery would be because of the myriad of skills that you would acquire through all these rotations, and it's all at your own disposal to help your patients and also to make money, especially in the private practice. So it's being offered by both colleges at the moment, the Ghana College of Physicians and Surgeons and the West African College of Surgeons. The duration of the membership program is a minimum of 3 years. I'm sure one or two reasons some people might delay in the completion, but it's basically an exit program. And at the end of the 3 years, you should be done. So we go through speaking from Confanoche's perspective, we do general surgery, we rotate in general surgery. In your first year, you do 6 months of general surgery. Then the final year, you do 3 months of general surgery. You may also have a 3 months opportunity to stay in the district to also do some general surgery, basically the surgery in general stuff. We also do 3 months of plastics, 3 months urology, 3 months of neurosurgery and then pediatric surgery. So there's 6 months training in trauma and orthopedics. And then we also do anesthesia rotations. What's after membership? After membership, or after the surgery membership or surgical surgery in general membership, you have the opportunity to do fellowship, your fellowship training. So you could choose from urology, you could major in plastics, pediatric surgery, orthopedics, neurosurgery, cardiothoracic. Even after that, there are also opportunities for you to do a post fellowship. So, for instance, if you're a general surgery fellow, there's colorectal surgery, and then there's laparoscopic surgeries all available. There's vascular surgery, plastic surgery. You can think of plastic surgery. There's cosmetic surgery, burns, and there's also hand, foot surgeons. And pretty much all these fields are emerging due to, because of the economy and then the needs of the people. So currently, the study shows that there's increasing demand for surgeons in all these areas. We also have some opportunities to do externships and then observership. Usually at the fellowship level, there are so many opportunities, even at the membership level. Governor, for instance, there is also an opportunity for membership observership in other countries, usually in Germany. Currently, University of Michigan is partnering. Yeah. So just like any other specialty, you need to be eligible, and the eligibility, is that you should at least completed your 2 years house job training. You should do a year as an MO in any accredited health facility. And then you should be in good standing, full registration with the Medical and Dental Council, and then you are in good standing. So currently, surgery in general is not part of the priority areas. But then if you came out top 10 of medical school, then right after house job, the college is waiving all the 1 year MOship practice. So primaries, West Africa primaries, it's about 300 questions. 300 questions is computer-based test. The first 100 is on anatomy. The second 100 is on physiology. And then the last 100 is pathology. And I must say that the exam is quite tough. It's quite tough, but it's purely a standard examination. Gynaecology is quite less tougher than the West Africa. Gynaecology has 100 questions, and it's also a CBT exam. Now, after primaries, then you apply for the program. In the program, you also go through a selection interview. You would always have to prepare, would always want to check your schedule. You log in early, you dress modestly, dress appropriately well. And basically what they want to find out, you do a brief introduction of yourself, and then you want them to understand why you're picking or you're choosing surgery as a specialty. And there are also some academic questions. And occasionally you would have some current or the items on the news. You want to find out if you are current, that you've been following the news. Training sites, we have the traditional teaching hospital, Kolebu, Konfanoche, Who Teaching Hospital, Tamale Teaching Hospital, and then the Cape Coast Teaching Hospital. So we have, and then KNUSC is currently started training, and Ridge is also training, 37, then Tema General, Greater Accra Regional, Eastern Regional Hospital are all training. But sometimes the challenge is that you have to do other rotations, such as if you're in KNUST, you would have to do your pediatric, cardiothoracic, plastic, and other rotations in, let's say, a Confanoche, where there's the traditional teaching hospitals. So Techiman, Brekum, pretty much I'm sure next year, next academic year, would start training properly. So the expectations of the residents, what you should know is that the whole program or the residency program is an apprenticeship job. Just like what the seamstress and even those who learn how to plait hair do. It's just like surgery. You work with the consultant, the specialist, and then you acquire skills and knowledge from them. So that's how residency, surgical residency is. Now, the challenge is that most of us sometimes do forget the main objective, but we understand that it's supposed to be a resident-driven program, and that is postgraduate education for us. The resident is the one leading the program. How much you learn depends on you. You should avail yourself, always be asking questions, because if you don't ask questions, they will not know whether you know or you do not understand what is being taught. Occasionally, you have your facilitators asking you questions. They really also want to quiz you all the time, but a lot has to come from you, because you will direct the learning, the kind of learning that you want to acquire from. There's the aspect of the work and then academics, and there should be that balance. It should always be at where it should be, at least punctual enough, report early to work. And some of the times you may have to, a typical situation is you have your elective, let's say your elective surgery day is tomorrow. You should get to, and surgery is starting at 8, you should be at least be in the hospital about an hour to help mobilize patients, instruct nurses, instruct bed managers for them to move patients to the place and get them ready. And then you call your seniors in so that you start. And when you do that, you get their attention, and then it's something that they're expecting from you. And that is when they will give you the opportunity to also do some of the procedures. So you should also be reading. They expect you to read, partake in group discussion, a lot of research also ongoing. So you could also part in that. The workload for the residents, I would say, would depend on the facility. Like for Confanoche, where I work, we have Confanoche pretty much receive a lot of referrals from almost the entire northern, from all the way from the north, from Western region, all the way. So many regions at the moment, over 10 regions that you receive referrals from. So you can appreciate the caseload on you. Now, the other thing is, it also depends on the rotation that you are currently doing. So if you are rotating in neurosurgery, you would take a lot of your time. General surgery would also take a lot of time. Occasionally, you have urology, plastics. Those ones are quite manageable, and then you can really work around it, especially if it's not your duty day or your elective day. If you're in urology tend to have most of their procedures could be done in just the procedure room. You may not require major proper theater setup. So that means that you can quickly solve your patient's maladies and then just have the rest of the time on you. And now the other thing is that the team dynamics. If you are the only resident in the team at that moment, then you should expect that you'll be all the time, and you spend a lot of time also in the hospital. Challenges with the program, your schedule. There's schedule concerns. What I mean by that is that you do not have control over your schedule sometimes. Yeah, you may not have control over your schedule, especially when you're on call. So I remember one of the time that we're on a duty, we had stayed around, we had operated till about 10 o'clock. So we thought 10 p.m. we could go home and then just rest and come back early in the morning. So I got home, showered, then around 1 a.m. So there was a call from the emergency that there's a hemoperitoneum, a young lady. Then we had to come back and then save life. So it's this residency, and then it's your duty to sometimes your schedule, your consultants would also call you in just to do a few things for you. And work and life balance, I'm sure by now we all know that there's nothing called 100% work-life balance. As we grow up, you make sacrifices, and then you choose well. There's a time you have to sacrifice and make time for family. It's all about planning and organizing. You make time for family. You can also make time for the social life. You can make time for the church. You can make time for chill ups. You can make time for everything. Yes, it's all about how you go about it, how you organize yourself. You have to sacrifice one thing. We are sometimes instructed to read at least 2 hours a day. So you just may have to sacrifice some 2 hours of what if you want to chill for 2 hours. Just that chilling 2 hours, you need to just read so that you are not overwhelmed during your final year. Now there's what I put there, cognitive load. When you enter residency, your first, even your first case, the questions that you receive, as if you've been there for years, you have been doing the program for ages, and then you've been around. There's this cognitive load. You are expected to know a lot within a short time. And I mean, that's how we've come to know that's how medical school training has been, even way back from medical school. So what you do is that when you have a case before elective your surgery, you would want to read about the procedure, know the different types of approach, and then you read about the procedure, the indication, the complications. Even when you have cases or patients on the ward, you read about their conditions. And when you read, you are always ready for their questions. And then yeah, it makes learning even easier for you. And then it makes you put you in a position where you can tease out or extract a lot from your consultants. Now, the other thing is a burnout. Burnout is real from all forms. It's real, but like I said, you have to plan your time, and nobody works all around the clock. No, there's always time. Have some time to sleep. Have some time. Don't be hard on yourself. It's a learning. I think it's a learning process. You wouldn't get everything at a go. It's a learning process. You don't be too hard on yourself, like you feel you're not achieving your goals. But gradually, you definitely get there. Now, sometimes the way rotations are also scheduled, and then based on the team dynamics, you may not have developed the kind of skills that sometimes you watch and you want to. But you always have to put yourself in that position. Get ready, always get the patient ready to theater early, and then preload the patients, be actively involved, reading about the case, and then you also be given the opportunity to do it. So my take-home message is that it's always a resident-driven, I'm telling you, it's a resident-driven program. And then always see every opportunity as a learning point, because there are days you'll be grilled and then not as if you are not smart, but know that it's a learning opportunity. Make the mistakes there and learn from them, but not mistakes that will cost patient life, but make and then learn from them. Okay, I think I'm done. Thank you.
Right. Thank you so much. We would move to internal medicine, and our resource person for that will be Dr. Med Dela Kweku Lecha. Dr. Dela, if you are here, we'd like you to take things up now. Before he starts his presentation, I just want to humbly implore our resource persons to go into the chat box. If there are certain questions there that you can provide responses to, I think now will be a good time to do that so that we can optimize our time. Right. Thank you so much, Dr. Dela. You can take over now.
All right, thank you very much. Am I audible? Just want to confirm if everyone could hear
Yes,
me.
please, you are.
All right. So in the next few minutes, we're just going to talk about becoming an internist in Ghana. I realized everybody is trying to advertise their rotation in a way, I think, except for the OBGYN, general surgery, and possibly internal medicine. And that's just because we do have numbers, but we're looking for more people. And many people view the internists as a club, a tight club with just a few people. We like ourselves and our thinking patterns and how we pride ourselves in being able to understand medicine. But we definitely need as many people to come on board as possible. Internal medicine in Ghana is not considered a deprived area, but our subspecialties definitely are highly in demand globally and locally. I'm talking about cardiologists, rheumatologists, those subspecialties that we've heard about. In Ghana, you need to do the general medicine training and complete that before you can go into these subspecialties. So we sort of just tag onto their the fact that they are needed to encourage a lot of people to enter medicine, of course, with the specialties. When we are, the need for us is increasing largely because of multidisciplinary care, which almost has a physician of a sort somewhere in the mix there. So definitely the opportunities are ever increasing. Now we have people who are doing interventional subspecialties and using their hands as well. So the traditional concepts of the physicians just talk is gradually being sort of managed. I won't say being phased out because the largest groups still do more thinking, less activities with our hands. So I think some parts of the registration and interview processes have been spoken about. You definitely want to visit the college websites. Our primaries are usually around the same time for Ghana College, West Africa, usually in March. Then Ghana College writes one in September. You just want to let your colleagues know so that when the adverts come out, they can share them with you. You want to fish out people who have similar aspirations. You would need them during the group studies and preparations for the primary examination. Pass rates vary on a year-on-year basis. Most people pass. And so, I mean, do take the opportunity to write one or the two. The primaries are valid for about 5 years for both colleges. Ghana College does interviews. West Africa, as of the last time I checked, they don't do interviews. I don't know whether they started that now. And when you start, so for example, you can write West Africa and use it to start Ghana College. You can also write Ghana College and pay $1,000 waiver to do West Africa, or you can just write the two of them, pass both of them, and enter both colleges. I'll address the advantages of each of the colleges with reference to internal medicine as a specialty. Training centers. We have quite a number of training centers. We're doing a lot of work to increase the number of training centers in Ghana, and more for West Africa than Ghana College. These are some of the facilities that currently have been accredited for internal medicine in Ghana. I put them in no particular order. I think it's more alphabetical than any other. Now, the question of where should I train comes up very often. I think that for adult education, the reasons are very personalized. For example, definitely the older centers like Salon mentioned when he was talking about OBGYN, Kolebu, Confanoche have existing, tried and tested, but rarely dynamic structures in that most of what they have is cast in stone, and we just keep using those structures. They produce results. And so definitely if you are the kind of person who likes to stick to what is known, what has been tried, you don't want room for any changes or any variability, definitely these older centers are better for you. They have a larger consultant to resident ratio because definitely there are more residents in these places than there are consultants. However, the college tries to balance that out, at least for Ghana College, but West Africa add-ons may increase the total ratio, but senior residents sort of complement that in the centers where senior residents are being trained in terms of teaching and guiding residents. Like my colleague before me said, a lot of the training in internal medicine is also resident driven. And so there's a lot of work that comes from your side, but these senior residents and consultants are very helpful. Now, other facilities here, beside the two main, Confanoche and Kolebu, have fewer but newer consultants with a better ratio try to do new things. They, however, don't have all the subspecialties. So I've reached, for example, uh, the specialties in-house, but there's some that we collaborate with consultants in other facilities to run. I mean, in our Enclave 37 and some private facilities where some of these consultants work, it gives you a bit of exposure into that space as well. And so I will not be able to speak for Go and other places, but I know that surely the ones associated with universities have quite a good number of consultant exposure. Now, with regards to content, of course, the foundation for medical school is relevant, which is most of what you will use from your for your primaries. And then we have our internal rotations in internal medicine, from general internal medicine, cardiology, nephrology. I'm sure most of you have come across these specialties already. These are our fellowship options. In Ghana, currently, we do not have direct fellowship options in internal medicine, so you can just go into cardiology directly. But when you finish your general medicine, you can decide to do a fellowship in general, internal medicine, cardiology, nephrology, whatever you're interested in, for an additional 2 to 3 years. It may be longer than that, depending on the specialty you choose and the opportunities for post-fellowship exposure in other countries, depending on what you want to do. We do some external rotations with radiology, laboratory medicine, just to familiarize ourselves with what is done for our patients when we refer them there and some of the things that are done there. Like I mentioned, so Ghana College, um, again, I avoided a table for this because I think that as adults, everybody has a reason why they choose what they choose. Most of our consultants will encourage you doing both colleges. I think that this is more of a traditional advice than a strict rule. And nobody beats you for choosing one, but they tend to recommend the two because, like I think Adjoa said in the beginning, you get two for the price of one. However, in internal medicine, there's some few dynamics that are a bit different. So you can do the West African program in 2.5 years, and whilst the Ghana College is mandatorily 3 years. If you're going to do something like geriatrics as your subspecialty, that's only available in West Africa currently. Maybe if you start now, maybe in 6 years, it probably will be available in Ghana College. Ghana College has more training centers. So if you already have a home, you have a family based somewhere, you're living your life as an adult, you have other responsibilities that tie you to other places. And Ghana College gives you more options in terms of centers that you can choose and train in and do what you need to do. West Africa, on the other hand, is limited to just Kolebu and Kofanoche in terms of accreditation. So some for the facilities in Accra, what they do is that, for example, Greater Accra Regional Hospital, you go for your rotations, some of your rotations in Kolebu, and then there's an arrangement for the consultants for the rotations you do here. Ghana College is signed entirely in the hospital, but if you're going to do West Africa, then some of your signatures may have to come from fellows of West Africa in Kolebu. I don't know how it's done in Marseille, But generally, this is the concept that applies for Ghana College and West Africa training. West Africa used to have a bit of more advantage in terms of international recognition, but in terms for those who may want to travel abroad to do subspecialties and stuff like that. But these days, that gap is widely closed. I know a Ghanaian fellow who just left the country to do an additional program elsewhere and did not struggle that much to get in. The other thing I need to chip in here is that, I mean, all of this schooling and the rest, beyond everything, money is one of our considerations. So just to put it out there that when you finish the Ghana College program, your certificate is ready in a month. West Africa takes averagely a year for your certificate to be ready, which you require for your upgrade. So just so you don't enter before you find out that these are the realities, or you choose one or the other. That's how come some people just choose the two, so that whatever can come, can come. But if you want certain things, as I mentioned, are more important to you, then the Ghana College may take a precedence over the West Africa or vice versa, depending on what matters to you. So thank you very much for your audience. I will stop here. I'm sure if there are any questions, they'll come up in the chat box and I'll answer them. Thank you.
Thank you so much. Thank you so much, Dr. Delali. We'll now turn our attention to orthopedic surgery, and our resident to help us with that would be Dr. Med Albert Akwesi Enin. Dr. Akwesi, if you are here, you can kindly take over now.
Thank you very much. I hope I'm heard.
Yes, please.
Okay, so I'm Dr. Albert Akwesi Enin, an ortho resident from Korle Bu. My colleagues have touched more on the primaries and how to pass. But generally, I wrote the West Africa, and as is known, the West Africa is a little bit more difficult to pass compared to the Ghana College. And it's the same thing. Actually, I have two sessions. The first paper is anatomy, the second paper is physiology, pathology, and some biomechanics combined. I mean, it's not surprising, we are orthopedic surgeons. Entering the program, I think you should have worked in the district or any hospital for at least a year. And you should pass your primaries, I mean, before you're eligible to study in orthopedics. It's been run by two colleges, the West Africa and the Ghana College. And as we all know now, it's a straight program for both Ghana College and West Africa. For the Ghana College, you need to have an interview. I mean, you choose a hospital you want, then you have an interview. The interview is more academic. I mean, you'll be asking more questions on orthopedics and some questions on trauma. But for the West Africa, you don't go through any interview. You just need to pick your pass letter. You go to the hospital, you go to the department, then you arrange with them when to start. But currently, I'm in Korle Bu, and that option is almost non-existent because, I mean, it makes planning very difficult for the department. So they prefer the West Africa guys and the Ghana College guys come together at the same time, which is usually around September. Unfortunately, the numbers they absorb is decreasing day in, day out. I mean, I can speak for Korle Bu. I mean, we were 14, we were the first batch, we were 14 in number. But I think last year they only absorbed only 5. So as I said, the number keep on decreasing. For the rotations, the Ghana College rotation and the West Africa rotations, they are not the same. There are some compulsory rotation that you do for both Ghana College and West Africa. But for the electives, for instance, for West Africa, our elective is neurosurgery. And for the Ghana College, the neurosurgery is dropped for 1 month radiology, 1 month orthotics and prosthesis, and 1 month urology. So that means if you want to do both colleges is a little bit difficult unless we started 3 months earlier, then you can incorporate that. But if you started or in September, it's a little bit difficult, especially if you're in Kwalibu. But for other facilities, I mean, there are ways around it. But Kwalibu is a little bit extremely difficult. Okay, so for the facilities that train for West Africa, there's Kwalibu and CAT. Those are fully accredited institutions that train. But for the partial accreditation, you have Temale Hospital, you have 37, and you have Focus for Ghana College. Okay. Orthopedics, as you all know, is a little bit physical and there's a mental aspect. For Kwalibu, we have 4 teams. Our morning meeting starts, usually we have our morning meeting on Mondays, on Tuesdays, and on Fridays. It starts around 7:30, and by 8:30 to 9, we are done. And each team has what it does every day. So as some are in clinic, some are in theater, some are doing ward rounds. For the coping mechanism, as the other said, I mean, surgery is more of an apprenticeship job. So you are with your bosses and you do what they also do. My boss always says it's like responsibilities and privileges. And immediately you get to his team, he always tell you that it's responsibilities and privileges. You have some responsibilities to do. So you have to get to know the case, you have to read around the case, the approaches they are going to use. I mean, you have cracked the patient. You need to know all those that before the patient gets into theater. So if you're able to read around the case, you can answer his questions, then I mean, he gives you the privilege to also scrub in, to partake in the surgery he's doing. Most of the bosses expect you to be around. And usually after surgery is the junior residents that go around and make sure that post-op plans are carried as as is expected. For the workload, actually for the clinics, that's where we learn more of the orthopedic stuff. So more of conditions concerning the musculoskeletal system. You don't see a lot of trauma at the clinics. But for the accident and emergency, that's where you get all your trauma cases. And you're expected to read around the case and post them on the various pages. And various questions are asked by your senior residents and by the consultant of the team. For the academic aspects, I mean, you need to know a lot at a time. Doing ward rounds, doing morning meetings, there are a lot of questions, there are a lot of things that you're expected to know. And that's where the guidance of your senior residents come in. Typically, I like Kwalibu because of the kind of senior residents that we have. I mean, they are willing to teach, and most of the times, those are the people you see more often. It's your senior residents. So they guide you with the learning, they guide you with the things you are supposed to know, and they give you a little bit of hands-on. And as I said, it's an apprenticeship. If you are the one who is always leaving for the house very early, then you don't learn anything. But if you are the one that stays with them for some time, then they are willing to teach you on how things are done. And sometimes they can even guide you the kind of questions you are expected to receive on 1 or 2 cases you want to put on the pages. So, I mean, their guidance is so good. I mean, if you have them around, life becomes very easy for you. I think that is all that I will share concerning orthopedics. I mean, after this, I'm sure there'll be questions that I will probably answer. Thank you.
Thank you too, sir. Finally, we'll take presentation on neurosurgery. To be given by a senior resident, Dr. Med Omane. Dr. Omane, if you are here, you can take the stage now.
Okay, that's great. Thank you so much. I think it's been an interesting conversation so far. Yes, so please, can you hear me? I hope you can hear me.
Loud and clear, sir.
Great. I would say neurosurgery. For me, it happens to be one of the most exciting and arguably one of the greatest residencies you could find yourself in. There's a saying that, the closest thing you can probably connect neurosurgery to is like rocket science or going to space. However, rocket science explores the external universe, whilst neurosurgery explores the internal universe. I think it's without ambiguity that the brain and the nervous system is the most complex system in the body. That's You do tend to have, or the training sort of requires a lot of precision, mastery, and detailing in terms of what we find ourselves doing. Given that kind of gamut of description, it also sort of implies that it's just not cut out for everybody. I mean, not. I mean, it looks nice on the outside, looks glorious on the outside, but then people like the glory, people like the nice things, but you would have to pay the price in terms of it's not like a soft life residency. I mean, if you want a soft life, then neurosurgery is definitely not a place for you. You would have to put in the time, you would have put in the effort. I would say without doubt, one of the most difficult residencies you can try to aspire to. It will take a lot of your time, will take a lot of your effort, a lot of brain work, a lot of strength work. But the rewards are pretty much amazing, both for your patient and for yourself in terms of remuneration. I mean, give and take across the world, neurosurgery operations or procedures are one of the, should I say, the highest costing, and neurosurgeons tend to be very well paid, even in our space or our context where there's a flat fee for doctors, depending on which cadre they find themselves in. You would see that because we are surgeons and then we operate and do other procedures, you will tend to invariably earn a bit more. And a bit more is just trying to be modest, but really a bit more than the average surgeon. And for even your small procedures, it's probably what someone gets for a major procedure. So, I mean, people say that there's money in the pelvis, but I mean, if you really want money, then neurosurgery is something you should consider. I mean, after a common cold, the next commonest complaint is back pain. And currently, as at 2020, 600 million people across the globe plus were, complaining of back pain. Now it's approaching a billion. And already in the United States, back pain is almost approaching $1 trillion industry, and the same across the world and wherever. And the issue in Ghana is, there are few neurosurgeons, the population is so huge. So we do tend to see a lot of patient load because of our low numbers. How can you enter the neurosurgery program? So we have the traditional pathway, which I did, that you do your general surgery membership, and then you take on neurosurgery as a senior residency program. But by the grace of God, there's now a straight program for Ghana College. So the Ghana College program, you sit for a primaries exam, and then you can start a 6-year straight program for neurosurgery. West Africa are yet to incorporate that. So with respect to the primaries, it's just like relatively any primaries deals with the basics of neurosurgery, mainly the embryology and anatomy, and the rest is just the physiology and the other aspects. Yes. The residency, surgery residency is basically apprenticeship. So you observe and then you try your hands, and then you try to become a master in your own way. And I think you should catch, or you should have a vision for yourself in terms of what you want to become out of the program. I mean, residency in Ghana, or no matter what field it is more like you being thrown into a forest, and then as you go along, you see your tomatoes, your onions, you see your animal meat moving up and down, and then based on your idea of what you want, what meal you want to prepare, you start gathering um, the things that you need as you progress. Because give and take, really, no one cares about you. So you have to care about yourself in terms of what you want to become at the end of the day. Because of the limited numbers, there's also limited subspecialization options currently. Currently, we are just training everybody to be a basic neurosurgeon. But in terms of the gamut of what can be done in neurosurgery, there's still far more that can be done. And when I say far more, it also means far more money that can be made from whatever subspecialization path you take. Okay, right from vascular neurosurgery to functional neurosurgery to even spine neurosurgery to all the other different segments that we have. I mean, we are still just scratching the frontier of what is really possible. So yes, you have to shadow, you have to learn as much as possible. It's very tiring in terms of, I mean, you close very late. Yeah. Currently, I'm with Kolebu, so we are just two senior residents. We do duties back to back. So my other colleague does 1 week, and I come in the next week, and that's how it's rolls. But I think it's exciting. Even as a resident, you do have the chance to have multiple excursions outside the country, especially because we have lots of these research work related travel opportunities, and also sort of these small how do you call it, small programs that are run across the world. So depending on how integrated and how willing you are, you can actually be, let's say, out of the country about 3 to 4 to 5 times every year. But so it's all how much work you can take, because you always have to produce something to earn your seat there. However, invariably, I think it's a cool program. Work-life balance. I mean, there's a lot of work and there's less life. Probably after residency, that gets better, because you can now choose how you are going to navigate your course. But within the residency, it's almost like welcome to hell, and you have to find your way out. And pretty soon you have to find your way out. I mean, pretty soon, not to waste all the time in a senior residency program. I think with that being said, yes, you have senior colleagues, from consultants to fellows, and then other residents across. So because of the straight program, initially with the traditional finish surgery membership and coming, we had just mainly Confanochi and Kolebu. But with the advent of the straight program from Ghana College, now we have multiple training centers. So we have Kolebu, we have Ridge, we have Cape Coast, you have 37, you have Confanochi Teaching Hospital, and you have Tamale Teaching Hospital. And because of our low numbers, we also sort of have a very strong community. We interact quite on a frequent basis. We try to have programs amidst ourselves on a frequent basis. So you can call it, we are some sort of fraternity amidst the broader medical fraternity. And we do tend to support and help ourselves. Because largely the distribution of consultants are mostly in Confanochi and Kolebu, you will find that if you happen to be in these two institutions, your experience is much broader, much complete, and much more richer than the other institutions. It's due to no fault of theirs, because they are also growing institutions. But with the Ghana College program, what they intend to do is that at a particular time, you rotate through all these institutions to sort of have an experience of what it is to be at those institutions, and then see how best you can learn and how best you can contribute, so that at the end of your journey, you are a complete neurosurgeon. I think at this point, I'll end here. If there are any questions, I'll take them. Otherwise, yeah, thank you so much. Thank you for the opportunity as well.
Thank you so much as well for that insightful presentation on neurosurgery. I would like to remind us that most of the questions that were shared in the chat session are being answered. So if you left a question there, you can go there now. Most of them have been answered, and then look up the answers for yourself. Before we go ahead and ask a couple of questions that have come through, I just want the technical team to project the flyer for me. I want to do something for the next couple of minutes. Yeah, thank you. Want to give each and everyone here on the call an opportunity to partner and support the Med Transitions Ghana team. So much goes into putting together an event like this at absolutely no cost to you. A lot of operational costs involved. And we just want to humbly implore you to, out of your own volition, willingly support this great cause. I've been around and seen Med Transitions do a lot of wonderful things for junior house officers, senior house officers, people who are looking into starting and writing their primaries. And now we are looking at the deep details of residency. And all of these have been done at almost nothing at your cost. But so much in terms of resources have to be pulled together to ensure that the program runs smoothly and comfortably for you. And at this juncture, against even our better judgment, we want to come out and ask you to support us. If you think that opting out of the program, of this Zoom meeting, and sending some resource across in terms of money will not be convenient, just take a screenshot of the flyer so that you can do that later. I'm just going to let it sit for about a minute, and then we'll hop on to the questions and answer segment. All right. Right, some few seconds more, and then we would start our question and answer segment soon. Okay, right. So we'll just move on to our question and answer segment now. To our ONG and surgery residents on call, someone wants to find out if you can briefly share on the focus areas for the respective primaries. Just briefly, which areas usually feature in the primaries exam. So I think we'll go with surgery first. So Dr. Gabriel, if you are here with us, you can answer that. If not, we would have to move to ONG.
All right. Okay. Thank you.
Welcome, sir.
Yeah. So, like I said earlier on, we have the West African College of Surgeons Primaries and then the Ghana College of Surgeons Primaries. West Africa, I said, is 100 anatomy and 100 physiology and then 100 pathology. So the questions were evenly distributed across all systems. So the anatomy was basically every system, every regional. Most of the questions were regional anatomy. And what you also need to pay attention to relations, structures, and their relations. Especially the one that's anterior, they tend to love the ones in the thorax, especially the pulmonary artery and then with the bronchus, its relationship and all that. And you would also have some clinical scenarios. So they will pick how you are able to apply your knowledge in basic science. So most of the exam is basic science, so anatomy, physiology. Ghana College has just 100, and 100 is and comprises of both the anatomy, physiology, and the pathology. And they will ask like basic medical school stuff. Sorry, 150. 150. Yeah, but it's cut across everywhere. So it's like a standard exam. It examines every system. That is what I noticed from the exam.
Right. Thank you. Our resource person for ONG, if you can touch briefly on the focus areas for the primaries for ONG. Is Dr. Kwashi still on the call with us? Okay, I doubt he is. All right, so this question is quite general. If any of the residents on call can help us with this. Someone wants to find out if you are given the chance to choose your preferred training center among the list of accredited centers. Anyone on call can add their voice to this.
I think the person asking the question should be a bit more specific. What residency is the person trying to do? And that would help us give a better answer.
Right.
I think there's been
Hello.
a whole section on preparation for the primaries exam. So maybe you can make the link for the recording available so that those who missed it can catch up on it.
Yes, please. Thank you very much. We'll do that as well. Okay, the next question. Someone wants to find out, especially with orthopaedics, if you would get a membership certificate or a fellowship certificate for orthopaedics residency. Hello, Dr. Kwesi, are you on the call? Or is anyone ready to answer that for us?
Hello?
Yeah, hi.
This is Dr. Kwashi. Sorry, I dropped off the call.
Oh, sure. What the person wanted to find out is if you can briefly mention the focus areas for the primaries for ONG.
Oh, okay. So for the Ghana College and also the West African College, usually the basic sciences in obstetrics and gynecology. And for the Ghana College, this book is usually recommended to me. It's basic science book. It's very good for such preparation. The West Africa, I took the West Africa actually not too long ago because I didn't want to pay a waiver. So that one, there is an update course material, slides, about 36, 37 slides. You can put my link, my number there. I'll create a Google Drive, and then you can get access to those slides. For the West Africa, those slides are enough. But for Ghana College, I think they have also started doing update courses. I don't have access to those slides, but then I think it should be hard to find. But in Chad was definitely very helpful during preparation for the Ghana College primaries, and then West Africa, the slides. Thank you.
Dr. Kwashi,
Hello?
since hello. Dr. Kwashi.
Yes, please. Did you hear my submission?
Yes, please, we did.
Yes,
I
please,
just
did you hear
wanted
my
to give
submission?
Yes, please. Hello.
Yes,
Dr.
hello,
Kwashi.
I can hear you.
Yes, just a follow-up question. Someone wants
Yes,
to know
I can hear you.
Yeah, someone wants to know if for a surgical residency, is it expedient that you have some surgical skills before the residency, or it's such that once you start residency, you will pick up these surgical skills?
Okay. I think the answer to this is that it doesn't really, it's always advantageous if you have some surgical skills before joining, but then to some people it's a disadvantage. Let me explain. If you have zero surgical skills before joining the surgical discipline, you have to know yourself and know that you need to up your game and then build up some competency with the surgical skills, i.e., you could join some workshop like MSSI for basic surgical skills, and then you can make sure that you learn from consultants as soon as possible. Because, I mean, some of our colleagues have zero surgical skills, but we are in third year right now. They are excellent surgeons, and some are still struggling. So I would say that it depends on you. And those who already have some surgical skills, sometimes they may become complacent. And excuse me to say, sometimes the district is not, sometimes you are taught by some very old medical officer. Some are very good, some too, they may teach you the wrong thing. So an opportunity for relearning is available for the training program. So it's always good to come with an open mind and know that although maybe you are coming from the district, 5 years in the district, you have some surgical skills, some of the things you've learned are bad practice. And then you have the opportunity to relearn. And then, so it doesn't matter. When you are coming, we call some people, they are fresh, or there's another term that is used, but it doesn't matter. It doesn't really matter. There's equal opportunity for you. And residency training is self-directed. You need to take a personal initiative. So even if some consultants prefer training those who have zero skills because they don't have a lot of things to learn. And some also prefer at least you should be able to do something so that they can build on that. So yourself and then know that there is room to learn. Thank you.
Thank you too. The next question I'm going to direct to Gado rep on the call, Dr. Amankwa. Someone wants to know, if you start a residency program and in the course of the program you have a change of mind, is it possible to start and write primaries in a different program and then transition out of that?
Okay, please, can I be heard?
Yes, please.
Yeah, so at any given point, even if you've reached your final year and you decide that you feel you're not going to do that one and you want to change, you can always change. You're not obliged to complete a particular one that you've applied for. You just that you would come and start from the beginning. So there are people who have reached third year, stopped and started another unit, and they are okay. Yes.
Right. Thank you, sir. To Dr. Gabriel Offe, someone wants to know, for cardiothoracic surgery, would you need to go through your membership training in general surgery before? Hello?
Yes. So currently you have to do general surgery. No, so you have to do surgery in general or surgery membership 3 years. So that is the advantage of doing surgery member. You know you want to be a surgeon, but sometimes you don't know the exact surgical specialty. You have a lot to choose from. So at the moment, there's no straight cardiothoracic. The pathway is to go through surgery membership, and then you continue to cardiothoracic and vascular.
Right. And then a follow-up question about I know you are not a consultant yet, but someone wants to know if someone is a pure general surgeon, as a consultant, pure general surgeon, is other things that that general surgeon consultant is not allowed to do in practice, or he has no limitations at all?
All right. So definitely, I mean, this question needs to be tackled also because there are legal consequences as well to the question. Yeah. So typically, what we have as general surgeons, I mean, the general surgeons fellows are, if you are in other jurisdictions like Germany, they call their abdominal and visceral surgeons. So that is what you have general surgeons do. They do abdominal surgeries and then endocrine stuff like the thyroid and then nephrectomies. In some jurisdiction, adrenalectomy, they do all those things. Yeah. And now there's increase in Ghana. It's the economy and the need for subspecialties are also going high. So you would have a general surgeon who might, I mean, why would a general surgeon go in and fix an IM nail? That's quite. Yeah.
Okay, thank you so much. Yeah, you did answer that. Dr. Enin, someone wants to find out if orthopedics residency is a straight fellowship program or it's an exit program.
It's a straight fellowship program, but after 3 years you write the membership exams. At least you also get some small money and some small to become a specialist in orthopedics. So it's a straight program, but they allow you to write a membership exam so that you can go for salary increment as a specialist. But that is not an exit program. You have to do your fellowship. So typically what I know now is that after your membership for West Africa, you can start anytime you want to do your fellowship. But for Ghana College, usually you start the fellowship the following year. So likely you start in January. So if you write the exam since September, October this year, you are likely to start the fellowship in January. So yeah, that's it. It's not like you just spend the 6 years, I mean, without any exams, and I mean financially it doesn't make sense.
All right. Okay. Thank you so much. I think that's all we have by way of questions for this evening. I want to personally say thank you to our resource persons. It's been such a lovely and insightful time. And personally, I believe that you'll be more than excited to hear people come back to you and inquire more with respect to guidance on their chosen specialties. And we'll be happy if you could share your contact details with us. It's an email, WhatsApp contact, so that we relay to such persons. Thank you so very much. At this juncture, we'll be taking our closing remarks by Dr. Med Vanessa Bokmakwe. Dr. Kwe, if you're on call, you can kindly come up now.
Thank you very much, Dr. Good evening, everybody. And I'm so glad to really see the end of today's program. It's been a lot of background planning, and I'm so glad that we finally come to the end of this 3-day event, which started, I think, in February, where we had a primary session. Yesterday, we had our very first session for our residency, and today we've had the climax with our day 2. I just want to thank God, and more particularly, I want to thank the doctors in residency, the Ghana Association of Doctors in Residency, for really collaborating and coming together to make this a reality. I believe a lot of times we would agree that mentorship in healthcare system isn't the best, and being here to witness our residents step in that gap to make mentorship that gap be bridged is something that I'm really grateful for. So thank you so much to every single speaker from primaries, from yesterday till today. I really appreciate you. The team appreciates you. We as prospective residents appreciate you for your time, your dedication, for being real, from whether we want to have soft life or balancing, whether we want to really be more academic in our journey. So thank you so much. I want to thank the GADO, I want to thank GMA, I want to thank JDA, and even FGMSA for being here as part of today's session. I also want to say to our prospective residents to be that we've been hearing this often from all 3 days that residency is a journey. It's a path that we take together. As much as possible, allow yourself to trust the process. It's not a rush. Remember that God is taking you through and God will guide you through it all. So always make sure that you're putting your best to carve your niche and be that excellent doctor that we are all looking out for. Thank you all for joining, for showing up, for learning, and we are grateful to have had you. Over to you, Dr. Medin Krumah. Just a little thing. If you'd like to be a partner to sponsor, you have a heart for mentorship, and want to be a part of this, you can easily reach me or any of the team members, and let's make the healthcare system of Ghana better. Thank you very much. Over to you, Dr. Nkrumah.
Thank you too, Dr. Kwe. We'll take our closing prayer now, to be done by Dr. Med Gura Mensa. Dr. Mensa, if you're on call, take us away, sir.
So let's pray. Father, we thank you for this evening. We thank you for a time like this. Thank you for the opportunity to learn. Thank you for the life of the people who organized this program. Thank you for the wisdom that you gave them to think about us. And thank you for the resource people that spoke. And for those who, out of their busy schedule, and some people say their rotation is like hell. Out of the hellish rotation and their tight family life and all that, they took time to come and educate us, the young ones. We thank you for every life that was involved in organizing this program and making it possible. Wherever that they are, we pray that your blessing will be upon them and that you bless whatever that they lost, whatever pockets that any dime came from to sponsor this program. We pray that, Father, you bless them mightily. We that are coming up also, we pray that as we have learned this, God, that it will go a long way to impact lives, that the purpose for which this program was done will be accomplished, that it wouldn't be that it was just done for just a show, but it will accomplish the purpose for which it was done. We pray, Lord, there are a lot of things, a lot of scratch. And that our patients will get good outcome, even in Jesus' name. Thank you so much for everything that you've done for us. Amen.
Amen. Thank you so much, Dr. Gura. Thank you all from the Med Transitions team. want to say thank you so much for sticking with us. We do wish you all the best in your future endeavors. Do have a wonderful evening and a lovely week. Bye for now.